What makes us unique? Here's the big secret. We treat the brain and the nervous system. It's your brain and your nervous system that controls everything that you do and feel. It determines how well you function. By making you function to the best of your ability is my main goal, and your best chance at being healthy and pain-free. So number one, we do oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and your nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, it helps you heal faster, and as we age, the ability to use the oxygen decreases. It's called oxidative phosphorylation. It's a big term. We have patients exercise using the upper body ergometer for your arms. It's like a bicycle. They do that while on oxygen, so we increase firing of the brain. By increasing firing of the brain, we help patients heal faster. Number two, we use brain-based therapies. We use specific brain-based therapies such as vibration therapy. Vibration fires the back part of the brain called the cerebellum. The cerebellum is responsible for three things: balance, coordination, controlling your spinal postural muscles, and lastly, it terminates our eye movements, allowing us to lock on a target. The cerebellum is also the most oxygen-dependent area in the body. We also use auditory stimulation by having you listen to sound in one ear, or visual stimulation by having you look at different pictures where you might perform eye exercises. We'll do olfactory stimulation where you smell different scents like peppermint or cinnamon. So if you want to stimulate the left brain, you smell through the left nostril. We may use a warm caloric, which is a water heated to 105 degrees and put into the ear. This stimulates the cerebellum as well, increasing the frequency of firing. It's very powerful for vertigo and dizziness. To increase the firing for different parts of the brain, we use these exercises. We use laser stimulation, and we hit specific points. We do adjustments, of course. We use manual techniques. If you're stuck, we use an arthrostim. For neurological, we'll do one side. It's called unilateral adjusting. We also do posture rehab exercises to restore your spinal structure and the tissues around your structures. One particular rehab exercise is cervical traction. Traction improves the cervical curve, and it also activates the cerebellum that helps improve balance with spinal postural muscles. Another exercise is wobble board training. It's fantastic. It's designed to improve overall balance and coordination, along with activating the cerebellum or core stabilizers. It looks like it's very simple, but it's tough actually. We do specific lab panels. If you have a chronic condition, you need specific tests. Thyroid panel, a CMP, complete metabolic. Number 3, a lipid panel. Number 4, a full CBC count, which is the complete blood count. Chemistry, excuse me. We look at your adrenals, your hormones. All of these can be affected by addressing any problem with your thyroid, your adrenal glands, your blood chemistry, or your gut function. We can help you physiologically to heal faster. So a complete metabolic panel allows us to check your blood glucose levels, since this is needed by the brain to function properly. We also do an adrenal stress index, which is an ASI. We can do this test with the adrenal glands with a test called the ASI. These are your stress organs, meaning that they react to stress. So if you have been or are under stress, this is a must. If you suffer from insomnia, we can look at your cortisol levels. So when the cortisol levels are abnormal, you'll suffer from insomnia. Cortisol levels can be corrected by specific nutritional protocols, thereby helping physiologically cure your insomnia. You can have an autoimmune disease. That means that your immune system is under attack, where a particular area is attacking itself. So we can check this out to see if you have an autoimmune condition. Some of these antibodies are gluten, like gluten antibodies. Tissue antibodies such as myelin, which is the fatty sheet around the nerves. We can check for cerebellar antibodies. The cerebellum, again, is the back part of the brain controlling balance and coordinated movements. We can also take a look to see if you have a bacteria called H. pylori. This is to determine if you have problems related to gut function. And lastly, I know, finally, lastly, right? We can test for decreased brain neurotransmitters, and neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. So does that sound unique, like we're looking at the whole person? You bet it does. So once we understand, we have the necessary tests, and we measure, test, treat, and retest, we do this proper neurological approach, metabolic, and structural approach. You have found the right place, and I look forward to seeing you in the office. This is Dr. S, and I've got your back.